Goethe said, act boldly and mighty forces will come to your aid. Welcome to the Anatomy of Therapy. I'm Dr. John Sobolski here with Bobby Riley, back from vacation. He went into the Highlands with his big Land Rover, pressure up and down on the tires, but he made it back. Welcome back, Bobby.
Thank you very much. Thanks for holding down the fort. That was a good episode you guys did last week.
Well, thank you. That was mostly Askey doing all the heavy carrying, and I was kind of holding on to his coattails trying to keep up, but it's always good having him. But it's better having you back, buddy. It felt empty without you. But this week, let's get into some stuff. The unintended consequences of therapy. You brought this topic up, and I thought it was fascinating. I can't wait to kind of get into it. But like, how did you stumble across this in the first place?
Yeah, it was just a rabbit hole, honestly. You know, I'm sure we've all done this where you go on YouTube to look up something that's actually important or relevant in your life.
Yeah.
Or Google something like, what is the actual time in New York where you're going to call your friend or something. And then like 75 minutes later, you know, you're reading about phlebotomy or growing your own garden or whatever it is. But I was reading a little bit on the law of unintended consequences and the origin of it. And it started, you know, I think with John Locke, and at least far back as we can go, and some economists and Adam Smith, but which I don't really care, to be fair, too much about. I was more fascinated by a guy lately in the 1900s who wrote a piece. I think he was a sociologist.
Mm-hmm.
His name was Robert Merton, and he wrote this kind of expose on this law, just kind of clarifying it a bit more. And he kind of categorized 5 things that kind of broke it into these categories. And I just found myself thinking about it from clinical perspective, and not necessarily all 5 categories equally, but some for sure. And I'm just thinking, you know, there's things that just start popping in my head, like the unintended consequences of the way that another clinician talks to their patient has this intended or unintended consequence of when they get to my office, they don't connect with me, or I have to retrain their way of thought because, right, you know, they thought that's a little bit of degeneration of L5S1 means they can never run again or something. So there's, I mean, everything we do in life has these, and well, sometimes intended and sometimes unintended consequences, right, and they can be good and bad. And my mind, being a bit pessimistic, focused primarily on the bad.
Yeah. There was one, my mind, you'll see a glimpse into how it works. There was a third one. This isn't part of the categories, like pre-categories almost of it. There's intended consequences, unintended consequences, and perverse consequences. So and perverse doesn't necessarily mean bad, you dirty kids. I mean, it just means a totally different line. And I mean, we can get into this more later, but I mean, I was thinking, like, even from a doctor's standpoint or a patient standpoint, like, are you talking about like a patient, you worked on their neck and they slept better? You know, I just wanted my headaches to go away, but I'm finding I'm sleeping deeper. Is that where you're?
Yeah.
Initially? Yeah.
I mean, like I said, I focused more on the negatives,
Sure.
but yeah, I mean, anything where, I mean, I just listened to a horrific podcast on Sam Harris about child pornography. Oof. And like this idea that these tech platforms like Facebook and WhatsApp and Zoom are basically amplifying this problem because of their platform. It's not their fault. And of course, it's not an intended consequence. Like, whatever you think of Mark Zuckerberg, he didn't create Facebook because he was hoping to spread more child pornography. But that is a consequence of it. It's completely right, unintended, unforeseen consequence of creating or of having this this amazing ability to share information so easily now. Right. So, I mean, now I wasn't always thinking that morose, you know, but
this podcast will brighten up. Stick with us, friends. Stick with us. Yeah. So okay. So you said there were 5 categories. Do you want to go over what those 5 categories are? Then maybe we'll jump into one and see where we go from there.
Yeah. And just, I don't think I've told you these or read you these. So see if you can come up with something as well on these topics. But Yeah, I think this was in the 30s. He wrote this article, but the first category was ignorance. Just, which I wrote down kind of understandable if you're newer, to the field or you're a new clinician. But and Merton said that the first two are by far the bulk of the leading to unintended consequences. So number one is ignorance, and number two is errors or errors in analysis.
Sure.
Three was immediate interests overriding long-term interests. And
Mm.
he said that this is actually most often purposeful. So like
Mm.
you kind of you know, that meth is not a great idea, but, and that there's going to be some consequences, but you just kind of look the other way for the short-term high in a way,
Sure.
right?
You know
Um,
me and my meth.
yeah,
Yeah, for
yeah,
sure.
absolutely. Number four is basic values.
Okay.
This one's a little tricky, but it's basically saying that we have our own internal basic values and that they can lead you to make actions that could be causing in the future something that's actually a negative. For like he used the example actually of, it was kind of interesting, of like a certain religious sect who works very very hard, and they have this like ascetic lifestyle, like work hard and you don't own anything. He's like, but what happened was, because they worked hard and didn't own anything, they started to accumulate wealth, and then later started owning more things because that work ethic
Mm.
that was devoted because of their religion
Yeah.
led to basically affluence in a way, and acquiring things. And it kind of like, it's like it killed out the trait. It eliminated the trait. So the
Huh.
unintended consequences was they eliminated their own belief system because of the result of this. But like for me, I was also thinking, for some people, veganism, for example, is fine and super healthy, I think, for some. But
Right.
for other individuals, it seems to be kind of catastrophic to their health. So in
Mm.
that instance, you could have somebody whose beliefs, for example, are that we want to protect all animals and maybe it's better for the planet, and but the unintended consequence might be that their health deteriorates, or maybe that it could actually go back to being ignorance or error. Maybe that actually wasn't better for the planet, or wasn't, you know what I mean, as
Mm-hmm.
ethical. Maybe we kill more animals with combining corn. I
Right.
don't know, but that was just an example that came up for number four. And then number
Interesting.
five is self-defeating. In other words, like there's a non-occurrence of an anticipated problem. Like it doesn't end up happening. And this one was a little tricky. And I wrote down, like, for example, let's say you're going to have, you're scheduled to have surgery, but the doctor says, you're going to recover from your surgery much quicker. We're not going to do the surgery until the swelling's down, or until this date, or if you live in a place where you can't get your surgery very soon, you might have some time to wait. But the point would be like, you're going to have this ACL repaired. We know that ACL recoveries do better if you're already strong going into surgery.
Mm-hmm.
So let's do your rehab.
Mm.
And then maybe the unintended consequences is that when you're starting to do your rehab for this shoulder surgery that you're scheduled for, you end up recovering your shoulder and you actually don't need the surgery.
Right.
Does that make sense?
Yeah.
So then
Cool.
it's a non-occurrence of an anticipated problem. You're anticipating the surgery,
Right.
right? So
Interesting.
you're getting ready for the surgery and you end up not needing the surgery later. That's the example I came up with. But
Yeah, no, that makes sense. Let's go back to the first one, ignorance. And you also said something interesting. So we'll break this down into these categories, into two categories, from a doctor's perspective and from a patient's perspective. Yeah. So
yeah.
let's you kind of touched on a couple of these, but let's break. Ignorance was the first one, I believe. Yeah.
Mm-hmm.
From a doctor's perspective, you already brought up, if you're a new kind of doctor, obviously you don't have the experience, you passed all your boards. However, do you really have that working memory of, all that stuff you learned when the patient comes in, and be active and have it kind of pulled? That's what I told you earlier about the Askey episode. That guy has an arsenal of information that maybe other people have been exposed to. He just also has access to it. So like, Askey's ignorance quotient is just low, 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 low. He's going to have something that's
Right.
going to be applicable here. But I also thought, from a doctor's perspective, even if it wasn't an experience or a time thing in terms of the ignorance, um, It could be an educational thing. So like, for instance, there are chiropractors who simply adjust, and they have not really looked into, let's just say, exercise science, or, deeply into rehabilitation stuff outside of your basic, eyes, Y's, and T's and rotator cuff bands and stuff like that. Like, there are varying levels of people who think about exercise and rehab in a deeper kind of way. Um, and so they might have an ignorance there, and that they don't even know that perhaps if there was the DNS, bear to 4.5 month, that they could also stabilize a core in that sense versus just manipulating S1. Um, what were those other examples of it? Yeah,
Yeah, I agree with that. And to some extent, it's not reasonable to expect you to know all information from all camps, right? Or all
of course.
courses, or all, be a specialist in every area.
Right.
But the the big thing to note about ignorance is like it's kind of like should be a duty of yours to at least work your way out of that category. It's okay in the beginning that you're going to be contributing to these unintended consequences, whether you are
Mm,
trying to or not. And just so, again, we're going to talk a lot about negatives, but of course you can have positives, and that's great. It's great when that happens. But I'm talking more about these, the negatives in this sense. But I think it's just the onus is on us to kind of, like you said, that take that ignorance quotient or whatever and bring it to a good level,
yeah.
so that this is not as likely to occur. And I was thinking, just like you were, about like the clinician's style of treatment. And I thought of that almost in conjunction with number two, like
Mm,
errors in analysis, because like the word I wrote down and circled was dogmatism. Like people are just dogmatic in the way that they do things. And this is not just clinicians, this is just humans.
right.
And if you're dogmatic in the sense that you think, medicine is a joke and that everything should be treated from a chiropractic standpoint, you are going to have some negative unintended consequences, like I promise.
Sure.
There's going to be some positives too, where you did some stuff where the patient maybe avoided things like over being overly medicated or surgery they didn't need. Or I
Right.
for sure, I'm not taking that away from you. But whether it's people thinking that manual therapy is the best way to treat, or you just have to make people strong, like just make everybody a power lifter, you know what I mean? uh Chiropractic is best. I think that dogmatism doesn't get you as many places as you might hope, especially when it comes to the long-term um, health of the patient in front of you.
No, okay. So I agree, and I have an opposing point of it as well. I agree with it, but in another sense, the dogmatism can help you shift the blame for not fixing somebody,
Mm,
because off of yourself and onto them. So man, I've adjusted people's necks like this, and all the headaches I've ever treated have gone away. So your headache must be something incurable, or you're not doing your chin tucks. And I can kind of, because I don't have a category for why you might not be better. My categories are the dogmatic three things I stick to. We heated, we put some stem, and I adjusted you. If it's after that, then it might be cancerous in my
mm.
mind. That dogmatism can allay some of your ignorance, I guess. Maybe would go back to both of them.
Yeah, yeah. I mean, that's a really good point, I think, of where we put things back on the patient, and that is
Mm,
definitely an error in analysis. Often,
for sure.
where we blame our patients for, yeah, their lack of recovery, or yeah.
I don't want to skip out on the patient side too,
Yeah,
because
they
and you
they
brought
do it to us too, right? They
Yeah,
do it
and
to us.
I think the ignorance and errors actually go hand in hand in many ways, obviously, with from the patient's perspective. So people could be like, "My knee is bone on bone. I heard that I'll have pain in my knee for the rest of my life," and I feel like, or they'll say, "I feel like it's bone on bone. It's crunchy. I hear it pop all the time." And because I hear it pop, it means my knee will never be better. And I've done how many times have you heard a patient say this? I've done
Mhm,
everything for my back.
mhm,
And then you're like, well, you're here. Have you done? And you quickly list some things and you expose their ignorance. And it's not really, I mean, they just don't know. And it is an error. So they may think there is nothing there. I promise you, there are people that think there is nothing I can do for my back. I have literally done everything for my
Mm.
back. And they honestly believe that,
Yeah.
right? Have you encountered?
Yeah. I mean, I just thought of a patient that I've been recently had sent to me who's a high level athlete who trains 4 or 5 hours a day and has had chronic shoulder issues over the past 2 or 3 years
Mm,
and has seen good therapists for this, good physiotherapy, chiropractors, um, just not really getting better. And then I got to this point where I said, "You train like 4 or 5 hours a day, right?" And she says, "Yeah." But then I asked, "How much of that time are you working on fixing your shoulder?"
mm,
And she said, "None." In other words, like, this was just a wrong strategy in the sense that it was like she's still looking for the thing that will fix her or the person that will fix her. And I'm thinking, like, I know you've seen really good people before me. I don't have magic hands. Chances are you're spending 4 hours a day doing crazy stuff with that shoulder, but not actually building it back up. So,
mm.
yeah, I mean, that's just what I was thinking of when you were talking about that.
Yeah, I think about dosing in that sense really quick, just to keep going on that therapy side. Like, a they think immediately, and it's, and they people, especially someone like that who's working as much, knows like you can't just take protein and creatine and get huge. You have to put some
Mm,
work in. You have to take that, and so that's like saying, look, if I just take this protein every time before I go work out, I'm just going to get huge, and it's the protein's fault if I don't get big. I'm
mm.
like, you got to push some weight around. You have to take part in this as well. So we can dose on my end. I can put my hands and loosen up a hip flexor or whatever, but you have to take that on as well.
Yeah, I mean, I steal Spina's line all the time of force is the language of cells.
Hmm.
And I use the exact same thing you do, but a little bit more hyperbolic. I say, listen, I can feed you steak and give you injections of steroids all day long. I'll tell this to patients, but you have to pick up the weight. Like, nothing, it doesn't matter. Like, I give you
Hmm.
high grade grass fed beef, 400 grams of protein a day, Dianabol and Winstrol and everything we can put inside of you.
Yeah.
Doesn't matter if you don't actually lift weights. So this is me just trying to put the importance on internal loading or active care to say, and that's what I was trying to get across to this girl, in the sense of like, hey, you train all the time, this is a chronic problem, but you don't actually spend devoted time to recovering that shoulder. I mean, maybe she did
Hmm.
2 years ago, and what was it, maybe some banded rotator cuff stuff.
Right.
It's not enough for something like dynamic like she's being asked to do with that shoulder.
Yeah.
But yeah.
So those are some of the unintended consequences of not like maybe bringing up expectations in the beginning of a visit. Sometimes same thing. I'll talk about like a blood panel that a doctor will get from you, and people will be like, "Well, we've checked my red blood cells, and my red blood cells need fixing, and I've been taking medication for my red blood cells." And I'm like, well, what about the white blood cells? Let's talk about the interplay of your cholesterol. You know what I mean? And so, like, if you can just kind of open up some of these other categories, it's not necessarily that this girl didn't think about it. She puts in plenty of work. If you give her the notion of, working on that shoulder in a rehabilitative sense, maybe she's like, I never thought of that. And just because perhaps maybe her old clinicians did or didn't, or they didn't put the emphasis on it, which is why I like you're kind of being hyperbolic about it. I think that's useful. But back to the unintended consequences. So like
Mhm.
your unintended consequences in ignorance as a doctor, and then an error. You said error was analysis and what?
Error or error in analysis. So
Error
like
in
like
analysis.
you're making errors in your analysis of what you think is going to happen, right?
Okay, let's get into this one a little bit because what would you say? What were the first ones that came to mind in terms of your error of analysis?
Well, I thought of the ones that bug me, which is more about patient communication from other clinicians. Um, this one bothers me because, I've often said, this analogy of selling furniture in an Apple store, like
Right.
expectations. People come in with to buy a MacBook and they're being sold furniture. It doesn't really match up. And like for me, it's partially because I have chiropractic attached to my name, but also because there's other people that they've seen before they see me. And when they come in, they have an expectation that they're going to get a MacBook or they're going to get adjusted.
Right.
And then they have these expectations based on what they've been told in the past. So I've been told, it's bone on my low back. And then like C5 always goes out of place. And I also get these ribs that pop out of place. And like, I need you to fix those. And I just didn't like the last person because he couldn't pop it in or something. And it's like, this now has switched from clinical care to just a psychology visit at this point.
Yeah.
And I don't like this at all. And this is what I, was immediately thinking of is receiving. And I'm not avoiding the fact that I obviously could have done this to another clinician as well. I set up some certain expectations for a patient incorrectly. And I'm sure I did, especially early on in my career compared to now, but made some bad, educational choices with the patient, what I told them. Like another one I wrote down is like thinking about disc injuries. I think maybe you went through this phase too, where you kind of interpreted McGill in the wrong way and you thought, well, neutral spine is perfect. Neutral spine is what everybody needs to be doing. And so you're intending to do something good for the patient in front of you because they have a disc injury. So you say, hey, let me teach you how to use neutral spine and how to hip hinge and all these things. Let me do some bird dogs. You can't flex because that's what creates disc herniations. And then what you yield, unintended negative consequence, is maybe somebody 10 years from now hip hinging to brush their teeth or to grab their toothbrush, or they do everything from a neutral spine. And all you got to do is listen to one rant by Spina on YouTube to know that joints are meant to move, and the spine is full of a ton of joints. Right. So there's this dichotomy between, what we kind of learn initially about disc injuries and what causes them, and that they're usually flexion intolerances, and we should avoid that movement. And you have this negative intended consequence where I've had people come into my office. I do remember somebody in Texas particularly who like hip hinged to set his cell phone down, hip hinged to sit down on the table. And I was like, is there a reason why you're doing this? And he's like, yeah, I had a disc herniation. And I was like, when was that? And he was like, I think 1997 or something. And I was like, you've been doing this since 1997? And he's like, yeah, because I don't want to have another disc injury. And and then you just put him on the table and you can tell that there is an unintended consequence of him trying to protect his spine that probably led to some degradation of his spine.
Yeah. I think about that, the beard guy. What's his full Instagram handle? The beard guy.
He says beard all that you can be.
Beard all that you can be. Something, and he has those like where he goes to sit down and there's like an X or a check mark, right? He's like, how to sit down properly, and he hinges, or how to pull the dishes out properly, and he hinges perfectly, squats overhead, and he does it in perfect form. But then he does things like around the house, it's like how to fold it, anyways. And so he does it with perfect form. And so, I mean, I've definitely done that though in the beginning as a younger doctor, being like, let's just keep it. You need to pull your shoulders down and back. And so people come in with their shoulders and they're literally like walking around like this. And you could tell it's unnatural. They're just doing it in your office, or maybe they've been doing it outside your office too. And then you're just like, well, they're like, yeah, I got these. It's just tight back there now. And you kind of learn, you're like, shoot, yeah, I guess I told you to put your shoulders down and back, but not always. Like you're going to give your grandma a hug and you're like, hold on, pull my shoulders back. Hello, grandma. Like, chill, What are the other common ones you think? So like, I mean, there's so many of these, even for new doctors, old doctors who never stop doing them. And I do think, I don't know. I think that you're right. The intention is there to teach a person about a neutral spine, to not harm their disc, perhaps in 1997 when it was all flared up. Maybe that's a good habit for a day or two, but ultimately you would like a range of motions, I imagine, that you could use.
Well, I just as a point, I think it's okay to remind yourself that some of this is not your fault and benign, and we don't know everything. Like we just still suck at so many things, and knowing the human body, and we just have things wrong. We just plain have them wrong sometimes, I think in the United States, it's still pretty mandatory to just take everybody's wisdom teeth out. And because they believe that that's a good thing in the past. And we're kind of finding out like, yeah, I mean, we didn't accidentally have extra fingers. Like if we
Right.
had a sixth finger, it's probably for a reason.
Huh.
We have these teeth probably for a reason. My point is that
Yeah.
we can go through phases where the social or medical opinion can be strongly for something that's just actually wrong. So in that case, like, we could say, hey, neutral spine is the best because all of our leading clinicians say this, all of our research is even pointing towards it. But then you find out in the future, whether it's 100 years, 1,000 years from now, whatever it is, actually, man, I look back at that time when we gave all these COVID patients hydroxychloroquine or whatever. I can't believe we did that. That's a malaria medication or whatever. You know what I mean? It's just
Right. Right.
some
Right.
of this stuff is not our fault, but it's when it's patently obvious that you just had a poor strategy, you had a poor reasoning behind what you were doing, or you were just flagrant in the sense of how ignorant you chose to be. You're 25 years into practice and you're, still causing CVAs or, because
Yeah.
you don't know how to screen a patient,
I
things like
mean,
that.
I want to get further into this, but like I want to try to think of solutions as well, because like what are the and I'm thinking actively of this. When you have to make some inputs, you have to do something to your patient, you have to prescribe them certain things. Like what would be, and I may not have the answer for this, what would be the things you would say that perhaps the unintended consequences would leave you in the best position? You know what I mean? Like where you're kind of hedging your bets a little bit. Like I think about it as a doctor. You're like, look, I have to give you this antibiotic for your infection in your foot, um, and it's going to mess with your birth control. But I know that, and I'm going to tell you that. But it's just very important that we deal with this infection in your foot and we kill that. You know what I mean? These are the other
Mhm.
unintended consequences. Oh, and the antibiotics are going to rip your stomach apart. So let's make sure your fiber is going good. And also, this other medication might not be as potent for a little while. So remember that. Like, that's the kind of doctor that you kind of need to be. And you don't need to give every kind of side bet, I think. You know what I mean? I want you to do this exercise. Let's just say these external rotations for your shoulder. Now, hopefully you feel that the back of your shoulder engaging. That's the posterior rotator cuff. If you feel it start to pinch, or you say you feel it in the front, then I want you to change and do this. Like you should have a couple little avenues, I feel like, with your recommendations uh, to hedge the bet, because there are going to be unintended consequences that you kind of cannot. You need to kind of know that you can't control all of that. Yeah.
Yeah. Like I think of what you're asking me here, and I'm thinking of anything that seems to disempower the patient in front of
Right.
you, I
Yeah.
think is not going to help. In other words, if you can empower your patient in some way,
Mhm.
that that is most likely going to lead you in a positive direction as far as avoiding some negative unintended consequences. Um, in the sense of, don't fear monger, make everybody so afraid of their x-ray like they're completely broken, and that,
Right.
tell them that they should never run again. uh, Telling them that, you fixed their injuries and they need to come to you, like you're the person. Now that kind of leads to number three, which is, immediate interest over long-term interests, where you even choose to, you know that the long term is maybe negative. Just rely on me, I'll adjust you, I'll figure out all your problems. You're not really empowering the patient financially in the short term, maybe even the long term. If you're good enough at it, you can increase that. But overall, for the overall well-being of the people in front of you, that doesn't seem to be the right answer. So I
So
do think this word empowerment with patients would be the way that you could approach, trying to, yeah,
so
nullify some of this.
I agree. Let me push back on that one point really quickly. You said, empowering the patient and people not relying on you. I feel like I know what you mean, but like, why wouldn't I want this person as a repeat business? You know what I mean? I'm a small business owner in Kansas, just outside Kansas City. Um, I got to put food on the table. What do you mean? I want this patient to come back to my office. Do you know what I mean? Like, where's the fork in the road here?
Well, I mean, this can be a little bit of philosophical differences between me and another person, because I
Mm,
don't think that a business model, like, we need a business model that's survivable, but I don't think a business model that's maximizable is like the goal. It's never been the
mm,
goal in my mind. It never will be the goal, in the sense of like, how can I set this up to monetarily make as much money as possible? It's never made sense to me.
yeah.
It's more of like, we do deserve money for our time. Our time is valuable, especially if you
Mhm.
do good work, and get paid for that money. And some people, if you're good enough, and I know McGill has talked about this, if you're good enough, you can charge people for your 3-hour exam a ton of money and they'll come pay it. But most people are not good enough to charge, $800 for a 3-hour exam, or whatever
Right.
kind of system you want to set up. It's not going to work.
It like so I'm it's a bit of well, I love and I hate this term, but a scarcity mindset. Like, I need to have this patient and see this patient every week because I don't know that I'm going to be able to get another patient. Do you know what I mean? You need to be able to trust that if you do good work, that they're going to send other people, basically.
Yeah, you can still get repeat. You still want to do enough good work so that you're getting repeat patients back. It's just that the turnover doesn't necessarily need to be so fast. You don't need everybody to come in every week forever. But
Right.
if you're good enough and you do it long enough, you're still going to have the person who tore their ACL in high school come back in for a shoulder problem when they're 23, and then they
Mm,
send their mom in because she has plantar fasciitis or whatever the problem is, right? You can still create this web of people that know you
right.
without demanding, unempowered care. You can still
That's
get
fair.
that. So people who don't think that that's not, it's not possible. It's not possible if you do what I do and see like move every year. Well, then you start
That's
over
tough.
again. Yeah, then it's tough because you have to start your web of your your network of people all over again.
Sure.
But I think it's kind of a false mindset to say, if I discharge people, how would I ever build my business? And that's just kind of nonsense. Like, people know you're good. They'll send people to you. They'll come back when they get re-injured. And I think, I remember listening to Mark Bell. You know who Mark Bell is?
Sure.
Yeah, like for strong, what's it called? It's whatever, some kind of barbell, not West Side barbell, but I can't remember his
I
gym.
can literally see the podcast cover in my mind, but I
Yeah,
can't
yeah,
get
yeah.
to it.
Mark Bell. He
Yeah.
invented the slingshot, all that kind of stuff. And I remember him saying in some interview, like, I don't know of anything else that teaches people what weightlifting does. Now that's all he does. He cares about weightlifting and training. But he was
Mhm.
saying, I don't know of anything else that can that can train somebody mentally to like learn these lessons as going to the gym does. And I was thinking about it for a little while. And I'm like, there's some truth to that, because it's a complete psychological thing to think about how much of life you're in control of, right? And if you go to the gym and you learn that, hey, if I do this 5 days a week hard for years and I do it right and I learn, like, I can go from a 50 kilo bench press to a 200 kilogram bench press, or I can become completely inflexible to being able to, Jean-Claude Van Damme it, just do the splits
Right.
everywhere. Like, you now know that you can create your own future. You can say, you know that if I put in the work, I can accomplish this. And
Mhm.
he was saying, well, that's for life and business and everything. So if you in the gym, you can see these results easier because you could see your muscles getting bigger. You can see the numbers on the plates, on the bar going up. But he's saying you can also do this with your business and your business model and your view for the future, or the kind of person you want to be, or the husband you want to be, or the spouse you want to be, whatever it is. He's like, and just him equating gym training to being like, he doesn't know a better system. And it's kind of hard to argue that. And I feel like that's what you're that's a good thing to aim for as far as patient care goes. Now, there's a role for passive care, but I mean, under the immediate interest overriding long-term interest, I did write down passive care. It sometimes can be very easy to apply passive care. It's not very energy demanding often. Sometimes it can be, sometimes not. It can just be easy to be complacent and treat people, like everybody the same, and just do this exercise or use the ball. And here we sell one for a 500% markup that you can buy,
Right.
and just do this all the time, and then I'll adjust you, or I'll just, you know what I mean? And I think it's it's a hard road to go down, an empowering road for patients, but yeah, something I believe in.
No, absolutely. I think in the beginning too, it's a little bit harder because, I mean, 10 years into it, you and I can be like, oh yeah, well, maybe you not, but like you see a patient come back after a year or 2 years. Like I started in San Antonio, I went to Austin, now I'm back in San Antonio, and I've had patients come to me from the first time I was in San Antonio. So like I saw this mother and her daughter. The daughter was like in 7th grade, and now she's like going to college. And I was like, oh wow. And so just because of the time and exposure I've had, it starts to also change. You're like, look, I'm going to help this person now, but knowing it, and look, it might be a year before they come back in. It could be 6 months if they're athletic and they hurt another body part or something like that. But even the sheer amount of time, if I was talking to a younger doctor, I would say, hey man, you're treating this patient now, but act like this is going to be a person who comes back in next summer because they started a new thing and something else happened, and they value and trust your kind of experience. Like sometimes it just takes stubborn people like me to bump their head too many times and be like, oh yeah, this patient is going to come back in 9 months. And that will start to change and inform the way that you treat that patient that day.
That's all good. I got nothing to say against it
Okay,
because
perfect. I have
it's
another
great.
I
I
have
like it.
another comeback. This that's from the patient. This is another doctor one, but it also has to do with say learning or trying new things, because as doctors, it is a good thing to get into a good rhythm in your practice, right? That's nice when you feel a rhythm fell out of sync. You're not testing. You're not connecting with your patients. All the various things that you need to do. But then sometimes you get a little bored and you're like, maybe I should. I saw Dr. Katie Clare put up all these cool exercises on hip mobility, and I want to start using these hip mobility things in my rehab program. But now I have to set it up kind of in my patient experience and the testing and kind of work that in and how that's valuable. And I have to kind of change the way that I think about these things a little bit to incorporate them. It reminded me of this, and I'll get back to that, but the Amish have a thing called Rumspringa, right? I think there's a couple other places, communities in the world that have it, where they go and at age 17 or 18, you kind of leave the Amish community and you go out and you do whatever you want. So in the Amish community, very strict. You're reading your Bible, you're going to church, you're obeying all the rules. And then at 18, they're like, hey man, you don't have to do any of this. Get out there, do all the things you couldn't do. Go watch TV, drink, drugs, sex, rock and roll, the whole nine. One of the tricky things with Rumspringa is that 90% of the Amish that go out on these things end up coming back and being committed to their Amish heritage. And it's a brilliant kind of insight by Amish leaders throughout the years, where if they completely limit their kids from doing it and they see like, look, we live one way and they live another way, and growing up like, well, I really would like to go play video games and smoke weed and girls, boys, whatever. And 90% come back. So I think back to doctors, there are so many times we get in this rhythm and roll, and this, we have a normal to us. And then all of a sudden we're like, we're going to break out of this normal. This is one of the negatives of like the self-helpy world. Because I mean, Tony Robbins says, he's like, motivation is like taking a shower. You know what I mean? It needs to happen repetitively. You need to start making this a new normal. But I do see this thing where doctors do this Rumspringa, and they go out and they're like, I can't get. Have you noticed this? Because they want to go back to the short-term successes. They miss their short-term successes. This is the short-term successes versus the long-term thing. Because if you go out on that Rumspringa, you start to lose those short-term because you're not in the same rhythm.
Yeah, I do. I do understand. I do think it's more of, I see more of, initially there's this more benevolent attitude towards the future. Like
Okay.
they have this belief system in the beginning that maybe they want to do this, this, and this, but then when they realize that that's kind of difficult, or I could make more money doing this, they kind of sacrifice some of that structure, that belief system that maybe they had initially,
Right.
that seemed, like, more hopeful. Like they were, we've all seen these movies, where the person starts out great and then they get corrupt. And I'm not saying people are doing that, but I feel like I see it more with, they had big ideas and dreams, but then it just kind of gets whittled down to what insurance allows and what their mentor taught them, and or
Right.
whatever their associate, and they work for somebody and they're limited by what they can do because their boss cares about how they treat and how many patients they see. And then that just leads to a system that they just get used to, like you were saying, and then they just get stuck in that system.
And
And
yeah.
just before I get up that point, I wanted to say that I'm not saying that, I'm pushing back on myself. I'm not saying that you should be like me, or that you should value empowering your patient. I wouldn't even say to follow that line of thinking. I'm saying, no matter what, if you're the most satisfied, busy chiro that's just joyful all day long, just every patient loves you too. I mean, these chiros,
I do,
those
yeah.
guys are, man, they got great clinics, great patients. They're just smiling all day long.
Mhm.
Still, it benefits you to stop and say, what are the possible unintended consequences of the way I'm doing things? Do you know what I
Right.
mean? You
Absolutely.
could be great in the office, but just not running your business correctly, and you get audited and you get shut down because of that. Whatever you know what I mean? You just have, by asking this question, you could possibly come up with solutions that you never, but if you never think about it, there's no, there's no growth to be had.
Right. And I think this is more so like those happy doctors, they may not be listening to this podcast. And if you are, welcome. The
Happy
people
doctors.
I like to, no, because
Everybody in
there
here is
are.
depressed.
There
Yeah.
are. Well, look, it's 2020, bro. I mean, let's not
Yeah.
get
Yeah.
into why you might be. But if you are, the Rumspringa, like, perspective of Rumspringa, like the fact that, like, look, if you know the Amish leadership, you're just the kid who wants to be satisfied in the moment. And then you go out and you're like, well, that hangover from Coke was just too much. I'm going to go back to the farm. You need to know that this is an effect that people take advantage of, and so, and this goes even further back to my thing that I preach often is like, where you were talking, you asked me one time, you're like, hey, have you gotten back into the PRI thing? And I'm like, no, I'm still stuck learning this one thing. Like for me, if I have to like really commit, and maybe it's just my learning style, commit and really dig into a thing, I need to fail at it. I mean, I think the research on neuroplasticity is it takes about 63 times to learn something new. And by what I mean by that is about 63 failures
Mm.
till you really get it, degrees of success with it, right? And so like, if you have to do something, you need to fail about 63 times before you give up on it, if that makes any sense.
Mm.
It's a bit of a Hegelian reversal, but that's my whole jam these days. But like, I want you to go out and fail 63 times at trying to get bigger in the gym before you quit on it. If you
Mm.
really want, to stay
Or
current on
pick
the
a different strategy.
correct, correct. I agree. So if you're stuck, stick with something. If you're stuck, go fail 63 times at something and see if you don't get better. That would be my challenge to the
Mm-hmm.
stuckness. But okay, so from a patient's perspective, that's kind of the doctor's one. The patient's perspective of short-term interests versus long-term
Mm.
interests. What what
Well,
what could we?
I just jotted down a few things of like return to sport or ridding pain, things like that. People that just want a certain, yeah, like pain relief is a big one. Just I don't really care. Like I'm not really concerned about rebuilding my my Achilles tendon. Just take the pain away.
Right,
What can I take for this? What kind of injection can you give me?
right.
There's a bunch of them for patients in this regard.
Okay, so this is a good one that I would like to get your perspective on legitimately. Um, Patients that come in and say they want pain relief But then in the very next breath, they will be like, but I'm really not into pills or shots. The main goal is pain relief. Because initially I'm like, hey, I'm a movement guy. I fix movement. And the things that help with movement are their tight muscles, weak muscles, all that sort of thing, right? So, but even sometimes when there's like, I just want pain relief, and depending on the person, if we've done some work and I can see some biomechanical advantages are happening through the course of our treatment, I'm like, depending where they're at, their demographic, I'm like, it is not bad to go get a steroid shot. This
Yeah.
is appropriate in this course of treatment. And I've had plenty of pushback on that, in that sense. You know what I mean? Patients
Hmm.
want relief, but they don't like pills. What, have you encountered this?
Yeah, a bit, especially, if you're a chiropractor, you've definitely come across this because the people that walk into chiropractic offices sometimes think a bit differently or try to be more natural approach. But I remember I told you this story about on that topic of it's okay to send people for an injection. There's a time
Right.
for it.
Yeah.
Remember that story I told you about a guy that was going on like a 3-week safari trip in
Yep.
Africa, and he came to me like 3 days before his flight or something. I'm like, listen, there's nothing I'm going to be doing for this bad disc injury in the next 3 days.
Right.
And he's had it and is more chronic at this point, and ridiculous symptoms. And I'm like, get your steroid injection. There's a chance that'll take it away for your trip.
Mhm.
And it was honestly like he was fine 100. I gave him a little few warnings like, hey, this is just pain, you still have a bad disc, don't be don't be out there doing Taibo every morning.
Right.
uh but he, like, the day he flew back, like, symptoms started to come back, and he came back kind of how he was before he left. The pain kind of came back by then, but
Yeah.
he didn't care less. He was so stoked. He was just, wanted to give me a hug. Like, I had a perfect 3-week vacation safari. Now let's deal with this disc injury. You know what I mean? He
Yeah.
could care less. So there's a time for that. And philosophically, I think there's no such thing as like right or wrong if it's the patient's choice. Like,
For
if
sure.
they say, hey, I don't want to do any active care, I just want you to adjust me and I'll pay you for that. That's when I go, I have no problem. I'll adjust you all day long. That's
Right.
easy. I'm not as good as some, but I'm pretty good at that. I can do that.
Yeah.
That's no problem. So it takes the burden of, as long as it's not unethical in the sense of that I may hurt them or something.
Right.
It's fine. I'll do that.
I think, and that your point with that guy and the 3 days before he goes out, you had worked in the timeline of expected benefit. You know what I
Mhm.
mean? I do think, and honestly, because of that story that you told me a while back, um, I've also tried to work in that to my history question. Like the common question: how long has this been hurting? When did this start? Now, very commonly is not followed up by, when do you need this better by? If there's a kid who has a soccer tournament this weekend, they'll tell you, little Bobby's got a soccer tournament, homeboy needs to play. You'll
Mhm.
know that. But there are some people that they may not really think about that. Like, obviously your guy's a smart dude. He was very aware of it. If I remember correctly, it was a pretty big trip. Obviously that's on the forefront of his mind. But you have to also consider the unintended consequences of why that person chose that point to come in to see you, from a doctor patient perspective. Like, sometimes I'll even ask that, like, okay, you've been hurting for 6 weeks. Why now have you come in? Like, is it just that, back to the failure thing, they have failed at so many things to get better? Because some people hurt and they just don't come in. There's usually some future thing. They're like, oh yeah, this weekend is my X, Y, and Z, and I need to get to that. And then you could tell that person, like, look, I can't fix this in 2.5 days. And then you don't lose that patient, because the patient is like, I'm going to go here. Think about the patient's mind. I'm going to go see Dr. Riley, and this weekend I'm going to be ready for this bachelorette party on the cruise ship, and we're going to go crazy, right? And you're like, whoa, 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 whoa. I can't cure your chronic migraines in one visit. So you need to know what I can do for you. Because if they think that, then you're never seeing that patient again. So I think it's very wise to kind of figure out what their timeline moving forward is as well.
And I think instances like this, though, are a great time to remember that projecting your what you value on your patient is not always a great thing either. This goes back again to the philosophy where I think if the patient wants it, whatever. If you want to sit in the woods and do ayahuasca all day long, I don't think anything less of you than if you become Elon Musk. And in my mind, it doesn't matter.
Right.
It doesn't matter. So like, not to retell old stories, but remember there was the other story too. I told you a long time ago about a patient I had that came in really sad because the orthopedist told him he can't run anymore because he has bad knees.
I think,
You remember that one? And
vaguely. Go ahead, tell me.
yeah, so he just comes in. He's always a happy guy. Comes in, and this goes right back to the law of unintended consequences, because I don't think anything negative of that orthopedist. He probably saying, "Hey, those knees look terrible on imaging. He should probably not run." Okay.
Yeah.
Now, whether or not that's a correct analysis or not, that could fall into category number 2, or number 1, or none of them. He could have been just doing what he believed to be true, but the unintended consequences is what I noticed when he came in. So when he came in, he looked sad, he looked unhappy, and he's never like that. So I said, "What's the problem?" He goes, "I can't run anymore." I go, "Why can't you run anymore?" He's like, "Well, the orthopedist said my knees are bad. It's like bone on bone. I can't." He said I shouldn't run on them. So I said, "What are you going to do instead?" And he said, "Nothing. Like running is my thing. Like that's what I love doing." And I said, "Get new knees in 10 years." You
Yeah.
remember this line?
Yeah. Yeah.
Like,
Yeah.
and actually it's a little bit of pat on my back. This was earlier in my career, but I just like, it was just
Yeah.
like an instinctual feeling of like, who cares? Like, if that's like the unintended consequences was, the intended consequence was you kept this guy's knees somewhat okay.
Mm-hmm.
If he's right, which we can just disregard that.
Right. Okay.
The
Yeah.
unintended consequences, maybe you created a person who's now chronically depressed for the rest of his
Right.
life. Maybe dies early of cardiovascular disease because he just sat around watching Rick and Morty reruns instead of doing half marathons and trail runs and all the things that he would have done for another 10 years. So I was just, replace your knee in 10 years. Okay. And then, I don't know, then try to run on your replacement. There's no right or wrong on these things. Just
Right.
because medicine says, you shouldn't run on replacements or after this much degeneration.
Right.
If you philosophically or mentally and psychologically are going to be destroyed by a certain action,
Yeah.
I think the game changes.
100, 100%. And that is why it's so important to like, well, I mean, your awareness of that patient, like, man, this guy's sad, you know, and you had enough of a relationship with him to know that that was a different thing. You know what I mean? To pick up on those kind of negative cues and base your treatment off of those things that are very important to the patient. Like, what is really important? Okay, and I'm totally putting this on the doctor. What is important to that orthopedist who he saw was to tell him how much he knew and how specific he knew stuff about knees. He had no connection to where that guy and his knees related to his quality of life. He just saw a knee, he saw some displacement and degeneration, and told him what he saw. He was treating, as they would say, he's treating an x-ray. Whereas you, another pat on the back, we're treating a person. It's not a little thing actually, but simple things like that will help you develop relationships and have a better outcome in terms of treatment quality, right? Like if you can just line up with what the patient is looking for, everybody wins, I feel, in that sense.
Yeah, and if you can't do that, there's this word that you can do. It's called referring.
Volt.
Referrals, refer out. You can
Like
send
where
people to
pain
other
goes from one
people.
area to another, like it refers pain to like the
No,
sciatic nerve. What do you?
like sending somebody to another professional who has
What the
skills that you
hell?
don't have. Like
Yeah.
if it seems very psychological and John Sarno works just down the block from me, I have no business treating that patient at that point.
Yeah.
You know what I mean? Like if Tony Robbins is working in the same clinic as me and the person seems obviously like this is a motivational issue, this is a psychological issue, you don't belong in my room. Like that's it. And that's okay. And we've talked about this before, that sometimes you think you're losing a patient, but you have unintended consequences that most likely positive that will come back to you by doing things like sending people to the right person.
Absolutely. Okay, so the last two you said weren't as common as perhaps the ignorance and the errors, the unintended consequences of your ignorance and your errors in analysis. But what are those last two?
At least Merton categorized them as number 4 was basic values.
That's right.
Number 5 was self-defeating. I gave the example already for self-defeating about doing rehab to strengthen something for post-surgical recovery, but you end up not needing the surgery.
Right.
So these are just kind of weird ones.
What?
But basic values, I used the example earlier of like a vegan person that could be honestly causing some harm later on if that particular person didn't take well to that diet. And I also wrote for the doctor's position, like if you value this, again can go back to dogmatism, there's some overlap here, but I wrote down like preferred care type, like
Mm,
what the patient wants, what the patient needs, versus your care type. You may have a belief or a value system. You have these values of what you think is important for the person, but it may not be what they need. Do you know what I
mm.
mean? So you can create unintended consequences by kind of what I just said, by
In a
like
negative, you're talking negatively though. Yeah.
yeah, like kind of the example of the orthopedist, which honestly I don't look down at him at all. Maybe that's what he's there for. Is he's supposed, he's kind of
Yeah.
meant to do that.
Mm,
But that kind of is like his value was imaging and the latest, evidence-based practice and ethical procedures on how to, recommend running to people with a certain degree
yeah.
of degeneration or whatever,
Right. Right.
right?
Right. Right.
That's fine. But the unintended consequences is maybe you just made an unhappy person now.
Right.
So I'm like, just have bad knees and be happy. It was just a different way to think about it.
Totally. It's
So,
okay.
but
So let me put a positive spin on it. Positive Johnny in the house, Pollyanna over here. Um, when I said previously that I was a movement guy, and are there unintended consequences in a positive sense? And could we play our cards in such a way that we might have positive unintended consequences more likely if we were to do something else? Like you can kind of work through some of the negative consequences and then stop giving people Lysol inhalers for their lung problem. You know what I mean? So what I meant by being a movement guy is that very commonly I'll try to fix it. Let's just say hip extension. I'm trying to fix hip extension, and there are many things that can inhibit hip extension, right? But my whole goal is to get hip extension, and there are a litany of things actively and passively that may stop that. But if my overall goal is to fix hip extension, uh, they all fall underneath that. So I might start via my testing and find out that the hip flexors are overactive and or weak and are inhibiting hip extension. Then what happens is I say loosely release, or a hip flexor lets go and allow some hip extension. And the person will say, ooh, I kind of feel my SI joint now. Do you know what I mean?
mhm,
This is a good one. Oh, my hamstring spasming up now.
mhm.
Other muscles will work. And so this is one of in my game to fix a person. I feel like if I go after movement, I get a bunch of extra things underneath that.
That's true. You were thinking more specifically clinical, but I was even thinking, if you empower the patient some way like that by giving them more hip extension, it could lead to more activity in life. And
Sure.
therefore, you don't even know how deep this goes,
Right.
right? Like I had a guy who was 450 pounds who came to me and
Yeah.
he said he tried, like to quote you earlier, like he tried everything.
Right.
And then I said, well, how did IF go? And he goes, what's IF? Okay, so you haven't tried everything. It's called
Ah,
intermittent fasting. And I gave him some ideas. And I've told you this story too, maybe in private, but fast forward 3 years and the guy is posting nonstop on Facebook of bicycle trips he takes with his whole family, and his
oh,
whole family
dang.
was overweight. So like all I wanted to do was help him lose weight. And to be honest, I could say like, oh yeah, I kind of had these future consequences. I was thinking like if I could have him lose weight, he'd become this great father or something. I
Uh,
didn't think about that at all I was like,
sure.
dude wants to lose weight, he's heavy, I can't even adjust him or turn him or anything, it would be great if he lost 200 pounds. I didn't even think about anything about how now he's cycling around Iceland with his family, and they all have
Right.
bikes, and they're all sharing that they're drinking sparkling water instead of soda. Like, I didn't know that would happen, and it's awesome, kind of positive consequence of something small that you tried to do that can lead to something else.
And I think those are kind of the moments that like keep people in practice and happy. You know what I mean?
Mm.
You need those connections to people on a real human kind of level, where you don't expect that, and you find something wonderful that happens. I'm sure their family would thank you. Uh, but that has to go with, again, the long-term thing, the looking at things from a multi-sensorial. So I think one of the other parts that we kind of skipped with this unintended consequences was that it is often part of a complex system theory, like back to the Adam Smith stuff. So like they were talking about economically, if you up the price of bananas, then perhaps also the price of apples might go up as well as your unintended consequence. You're just trying to sell bananas better and you ruin the whole fruit market. But you need to remember, like, you need to take in these other systems. There's too many systems to consider. So if through that history you can find the most valuable things for those people, what their big system is, and then gear your work, your influences towards that direction, I feel like that's what you're saying. Yeah.
Yeah, or at least think about it in your own life, think about it in your own practice,
Mm-hmm.
think about it in the person in front of you. I mean, I think all of us, the best of us, Askies, we can all still stop and think about these consequences. And of course, like you said, complex systems theory, it's called that for a reason,
Yeah.
because it's super complex. And that's why we have internal medicine doctors, and we have, kidney specialists and liver specialists, is because it's so hard just to know everything about the liver, much less know how it all interacts with the rest of the body. So
Right.
it's kind of, you just do what you can. But I think, to close, like, I just think thinking on it, resonating on it, simmering on the idea, considering, ask it about your business from the business side of things, ask it from the clinical side of things, ask about, your patient retention or your referrals or any kind of aspect, or your outcomes, how well you're actually getting people better. Anything, any of these aspects, that's just ask the question and see where it leads you.
Yeah, taking a little bit of a zooming out on the Google Maps and seeing the larger consequences, intended or unintended. Like, you don't you intend what you intend, but you may not know all the wonderful things you may or may not do, and it's impossible to know everything all the
Mm.
time, for sure. But if you could take a second to step back and reflect, I think that's really what you're trying to get at here, and I think that's a good lesson for all of us.
Yeah, I mean, I think personally, I intend to solve the clinical problem in front of me too
Mm,
much.
mm,
So, me and you can pat myself on the back for the cases I mentioned before, but I don't always do that. I
yeah.
lose patients because I only thought about their case. I only thought about, why is the medial femoral condyle wearing compared to the other leg, right? Or whatever
Right.
it is. And the person's kind of just bored, like, this person's not connecting with me or whatever it is. And
Right.
so, I mean, I'm guilty of this as much as anyone else,
Right.
in different, we all have our strengths. And I'm just saying, these are reminders, to ask these questions, and you can maybe hone in on the areas that, you can improve on.
I think that's a great way to close, man. Bobby preaching over here. Find us on Instagram. Find us on YouTube. We got all sorts of great stuff going on our Pinterest board if you really want to get into it. But Bobby was going to jump in on Pinterest. I know you're a big Pinterest dude. But anyways, thank y'all for listening to the Anatomy of Therapy. Tune in next week. Later.
See you later.